አኮኩሉ ፋሚሊ የመረጃ የምክርና የአውታረ መረብ መድረክ ነው። ለእናንተ ጠቃሚ የሆኑ መረጃዎችን በጤና፣ በትምህርት፣ በንግድና በተለያዩ የማህበራዊ ጉዳዮች ይዘላችሁ ይቀርባል።
A recent NIH research on youth health stated that PATS is usually misdiagnosed or unknown. Because of that, most youngsters do not get the appropriate diagnosis and treatment. What is PATS? PATS is postural orthostatic tachycardia syndrome. It shows that when you stand from a sitting position or from a lying position, your blood pressure drops sharply. Because of that, you will have dizziness, lightheadedness, tachycardia, meaning fast heartbeat, and stomach pain. It could be nausea, vomiting, and other symptoms. Because of that, the healthcare professionals have to be aware of these PATS. PATS has to be appropriately diagnosed. If it's not diagnosed and treated, people may not be able to go to school and be able to go to work because it takes them to a point where they have to travel on a wheelchair because they couldn't keep their head balanced, their balance because of low blood pressure. So PATS, what is the cause of it? Is really what is the problem? Majority of the time, it's unknown. The reason is unknown, but in some cases, head injury, surgery, major surgery, pregnancy, or viral illness can trigger PATS, but in most cases, it's not known. PATS is abbreviated as POTS. So what the doctors are saying, we have to know, especially healthcare professionals have to know to diagnose it and treat it on time. PATS, it is usually seen in women from age 15 to 50. When it comes to the symptoms, youngsters do exhibit lightheadedness, dizziness, with no abdominal pain, with no blood pressure change, but fast tachycardia, fast heartbeat. They can show these signs. Still, with this limited signs, we should be able to diagnose PATS. So my message is whenever you go to the doctor, if you have these symptoms, like the recent case that I've seen on a youngster who's 15 years old, she has very similar symptom. When she went to the hospital, they told her, oh, it's anemia, meaning low red blood cell count. So they were treating her for anemia, even though their lab shows it's normal. Complete blood count shows normal results. And she was also told to drink as much water as possible to keep the blood volume up. But in her case, both methods did not work. So she had to go back. So another thing that they said, the treatment can be like drinking enough water, increasing salt intake. But other than that, medication can be given to lower heartbeat because heart beats fast. It can cause tachycardia. It can be given to lower heartbeat or to increase the blood pressure. This will be helpful. Compressor stockings too will help to pump the blood from lower extremities to the heart. These are the treatment regimens currently in the medical field. But what we have to know is to advocate for ourselves in case it gets misdiagnosed. So PATS is usually seen in youngsters, and parents and kids as well have to be aware of this situation to treat themselves.
ዌብሳይታችንን akokulufamily.com ይጎብኙ። በሶሻል ሚዲያም ከተሉን። akokulufamily